This is Inspirational Women, a weekly series shining the spotlight on female trailblazers making a true difference in our community. Once again, here is Kate Daniels.
Dr. Navya Mysore is a primary care physician, women's health leader, mother, and dog mom. Dr. Mysore was born and raised in Montreal, Quebec, where she completed medical school and family medicine residency at McGill University. Now she lives and practices in New York, but in a way, she has a practice, a connection with any of us across the country, as she is the medical director for Nurex from 30 Madison, leading efforts to transform healthcare by making it more accessible and affordable. And we get to spend some time with her this morning and get some important insights about caring for our own health at whatever age we are. Dr. Navya Mysore, good morning. Thank you so greatly for being with us this morning.
Thank you for having me, Kate. I'm really excited to dive into conversation today.
Oh, I am too, as I sit here with my cup of coffee, imagining that we're in your office or perhaps in your kitchen sharing this beverage, and yours would be coffee, tea?
Yeah. Coffee.
Yes.
Coffee. Yeah.
Well, coffee is... Well, here we're talking about women's health and the good things we need to do for ourselves, the pitfalls we want to avoid. And so, well, what about coffee? It keeps going back and forth as whether it's good for you, it's not good for you, it's really healthy. And I'm sure the amount that we drink and consume has a real impact on how it is healthy or not for us. So what's your stance? What do you recommend for women?
Yeah, totally. That's a great question. And, I think there is so much out there in terms of recommendations and what you should do and what you shouldn't do. Generally speaking, I would say for coffee, I usually recommend my patients just like moderation, right? So there's no evidence to show that having, a cup, 2 cups, even 3 cups of coffee is necessarily going to impact your health. I would say to someone, and this is women, men, anyone, frankly, that if you find that your sleep is interrupted at night and you are having multiple cups of coffee, especially afternoon, like into the afternoon, that's where I would probably back off. And or like symptoms of reflux, like if you're having a lot of reflux, that might be another reason why you want to back off on the number of cups of coffee you're having. Generally, I usually will tell people try to keep it in that 1 to 3 bucket of cups of coffee. That third would be great if that was like a half calf instead of like a full caffeinated coffee drink. And then for pregnant women, so I get that question a lot from women who are pregnant, I usually will recommend, 1 cup of coffee, 2 cups is also okay. Generally speaking, I think anywhere in that 1 to 3 also would work for pregnant women. If you wanted to have that third as like a decaf, I think that would probably be best. But again, you're going to find so many different viewpoints on this. And general rule of thumb, I would say for many things in life is moderation is best. And also like no specific thing to be worried about in terms of health outcomes by having a little bit of coffee.
Great. So that's good bottom line. And
Yes.
I was kind of thinking to myself, though, I have generally 1 cup. However, my cup, this, a hot mug, is 20 ounces. So I'm not.
That is a very good point. Very good point, right? Yeah, absolutely. Taking into consideration what the volume or the size of your cup is, absolutely makes a difference. So when I'm saying 1 to 3 cups, those are sort of 8-ounce cups, like your general sort of like coffee cup that you think of.
Yeah. Yeah. So it's always good to have some of those peripheral details ironed out so that we know what the right thing is.
Yes, absolutely.
So, Dr. Mysore, you first came to my attention in terms of a message I got that talked about, TikTok myths about healthcare, what we should be doing for ourselves. And I think, well, it's TikTok that was mentioned, but there are just, all the social media in general. There are these kind of health and suggestion items that pop up, and you should do this and you shouldn't do that, and it really gets difficult to know what to pay attention to and what not, because it's right there in your face. And so I think it's important to get your take on what this TikTok and what we might see on Instagram or Facebook or just blips in general. What does it mean for us?
Yeah, no, it is a topic that I feel like constantly is evolving and changing with what's out there. And, I think it's tempting, right, for especially the younger generations who are accessing a lot more of social media, Instagram, TikTok, whatever it may be, that it feels relatable. This content feels really relatable, right? Like you
Yeah.
look at it, it's attractive to look at. It brings your eyes to it. You feel like there's a community feel. And so the idea behind that makes you want to believe what they're saying. And these individuals, they may be putting themselves out to be like influencers and wellness influencers, hormone gurus, nutrition and individuals who have expertise in nutrition. I will say like there's two buckets of information out there in social media, right? There's a good information that is evidence-based, coming from an expert that is vetted, that has that sort of experience and ability to speak to valid facts. And then you have individuals who are coming up with content that don't necessarily have that backing. Not to say that what they are saying is untrue, right? They very well could be saying very true evidence-based fact, and spreading that information, which is excellent. But I think as the viewer, we need to have almost like a toolkit or box of ways of trying to understand or decipher what we are looking at to be able to understand if that is true. And the danger lies in if someone is not able to do that and sees this information out there that looks really relatable, that looks interesting, that feels like it's authentic, and they might believe it and they might start to practice it. And then that's where it becomes like a dangerous slippery slope, right? Where it could have negative ramifications on your health, depending on, what is being shared and what the information is. And so I think it's really, really important for us to like differentiate that, like, social media is not bad, right? I think it's a great avenue to spread good education, evidence-based education. But as the viewer, you need to really know what is real and what is true out there. And I do think, the people creating content too should hold themselves responsible to making content that is valid, that is evidence-based.
That is great to establish that as that foundation. So thank you
Yeah.
for your professional experience and take on it all. So one of the things that had popped out to me in terms of the information I'd received and what might be said on one of the social medias, and I did not witness this, but I guess like it was said that SPF is bad for you, and yet here we are in the middle of summer, but in the winter we travel maybe to hot places. SPF, using sunscreen seems like the thing we should be doing.
Absolutely, absolutely. And it is, myths like that that really just get me fired up. And a little bit angry that we are spreading information to individuals who could take this seriously, practice it, and then down the line have negative ramifications for their health. UV sun exposure from the sun is a known carcinogen. It can increase your risk for skin cancer. Every person has a different set of risk factors. Some people might be at more risk depending on the color of their skin, the amount of melanin they have in their skin, and the protection that that's allowing them to have. Also, depending on what they are doing in terms of their livelihood, are they spending more time outside, less time outside? There's so much evidence out there that shows us that direct sun exposure can lead to skin aging, premature aging, risk factors for skin cancer at a cellular level, right? Like it is changing our skin cells at a cellular level. And this is how we start to develop skin cancers over time. Some are the basal cell carcinomas that often people will be diagnosed with at the dermatologist's office that, generally speaking, are quite benign and, can be treated pretty quickly. early, all the way to melanoma, which is can be really serious. And so I think people who are creating this information have a reason to create this information, right? But really, I think what's important is for the viewer to understand what this actually means. And so breaking it down, is this person trying to promote a product? Is this person, you know, talking about facts that are based on a validated source? Where is this information coming from that is allowing them to say this and for it to be true, right?
Right.
I absolutely will say sunscreen is pivotal to our skincare in the summer, all throughout the year, frankly, and especially in the summer, along with other things that we could be doing, right? So staying out of like the heavy sun times, like, a key in the afternoon, trying to avoid those times to have direct exposure, making sure you're wearing hats, making sure you're wearing even like clothing that has like UV protection that can be really helpful. So there's a lot of things that we can do towards sun protection, but sunscreen is pivotal as part of that.
Yes. So do not take something like that as gospel truth, I guess, without verifying it and checking other sources.
Exactly.
Right? Yeah.
Exactly. Checking other sources, going back to your primary care doctor and talking to them, sharing what you are seeing to understand what their thoughts are, to get sort of like a professional's opinion on it. And not to say that your primary care doctor is going to have the answer for you at all times. It could be that you may need to do more research on your own to find more validated information. It could be that you want to go see a specialist per se to then talk about something that you are looking at. It also could be that you're not being heard at your doctor's office, and that also happens too, right? So
Hmm.
I think it's important I understand people's reason for seeking out information and being educated. I think that's really, really important. And I want everyone to do that, right? And especially in this day and age where information is so easily accessible, I think it's imperative that we educate ourselves and that we empower ourselves with valid evidence-based information. But I also think it's important to understand where that information is coming from and to have the support to be able to understand that. So if you're not getting that from your primary care doctor, then that might be a sign that you may need to find a new primary care doctor.
And and that I think is a really key point. Things, of course, in that whole arena feel so challenging these days with getting in to see a doctor. I know initially when I had to change doctors because my doctor retired, there's long waits, but we need to really press forward in that so that we do have an educated, trained medical professional that we can bounce these ideas off of.
Yes, absolutely. Absolutely. And in this day and age, like technology is changing and the ability to communicate with your healthcare professional is also changing, right?
Hmm.
So
Right.
in many, many places, yes, there's the brick and mortar where you're able to message your provider. In other instances, you may be able to message your provider through your phone, right? A great example is Nurex, which is, the company that I work at. I'm the medical director of women's health there. We provide birth control, emergency contraception, as well as a host of other sexual and reproductive health care services to patients across the country, all through your phone, all through text-based care. And so a lot of counseling happens there with patients. And so counseling that they may not be able to get as easily if they had to, get an appointment in brick and mortar and to your point, wait months, days, in hours in the waiting room, to all of which to just be frustrated and or potentially forget the question that they wanted to ask in the first place.
Yes, or something else has come up, and now you're beginning to have
Exactly.
that laundry list,
Exactly.
right?
That list when you go and see your provider. And, for the most part, you get like what, 15 minutes with your provider.
Yes.
And it's hard to always get all of that list in. So,
Yeah.
Yeah, I think it is challenging, but technology is changing, I think, for the good, for us to be able to access some of this information, uh, in a more easier way than it was before. But it does take a little bit of that tech savviness to be able to access it for sure.
And so you mentioned Nurex for whom you work, and that is, and you said, helping women across the country. So that's nurx.com.
Yes, nurx.com,
Yeah.
nurx.com. Yeah.
So that's a great resource. So here we are using technology in a very constructive and dependable way.
Absolutely,
Yeah.
absolutely. And to get valid evidence-based information for the concerns that you may have.
And the other thing is that you are the health medical provider, well, information provider for Women's Health magazine. So, again, another resource, right, to tap into that is going to have really grounded and well founded information.
Yes, yes. And that's another great point that you bring up of knowing where to look, right? Like knowing what your resources are. A lot of the media outlets out there who have, health information generally will have health experts behind them who are vetting the information, reviewing the information. If you look at a blog or if you look at an information off of a magazine and it's online, you often will see a little check mark with like the healthcare provider's name next to it to say that it's been reviewed and vetted. That is really important to look for when you are trying to understand something or reading information or searching for answers. That will help to give you the confidence that this has been reviewed by a healthcare professional to make sure that it is validated and evidence-based.
Yes. Natural products. That too has many definitions. And we see natural, though, and I think we feel, oh, this is really safe. This is really good for me. But again, that's where we need to be checking into more of what is behind this and what really is safe and good and natural for us.
Absolutely. Natural doesn't equate safe all the time, right? And I think that's important for us to get across, right? And you'll hear a lot of different myths about different things, but generally speaking, birth control is a great example of like birth control isn't natural, so birth control isn't safe. That is the furthest from the truth. Birth control is pivotal to help for pregnancy prevention and for a host of other reasons why a woman may want birth control to help with their conditions. It could be PCOS, endometriosis, a heavy cycle, period irregularity. There's a number of reasons why a woman would want to be on birth control, and it is helpful for them for that reason, and by all means, not toxic or unnatural, and the natural perspective also can be is seen in so many different instances, right? I think HRT is a great example for menopause, where a lot of people say like HRT is not natural, and so there's all these other hosts of natural things that you can use for menopause. Not to say that, supplements have their place, and I do think that supplements are great and can be very helpful. They may not be the answer for every patient. And so I think it's important to recognize that, right? For some, black cohosh, evening primrose oil, which have some evidence towards like menopause management, can be helpful for a patient. For others, it may not be enough, or it may not help them at all.
Mm-hmm.
And so in that instance, are you going to say, no, we're not going to give you HRT? Absolutely not. We want that patient to feel like they can get back some of the quality of their life. And that's where HRT plays a really big role. And so I really want to get away from what is bad, what is not bad. Certainly there are things in the medical world, like medications that are used inappropriately that are not safe. And certainly there are natural substances that are not safe for you to use for a particular issue. But there are natural things that are helpful for you, and there are medications that are helpful for you. So instead of labeling them as bad or good, let's just try to figure out what is good for the person in front of you, right?
Mm.
Every person's need and solution is going to look different. And I think labeling it bad or good is not really helping anybody, frankly.
Yes. Oh, that is so well stated, that each person is going to be a little bit different. So, not to feel that, oh, this particular regimen was so perfect and this is what the result was. But yes, we maybe live in a different part of the country or the world, and our body makeup is so different too, and all of that. So, yeah, that is so critical.
I can't tell you how many patients I've had, in the menopause space who have really pushed back on HRT, for a number of reasons, right? It had a bad rap for a lot of years for various different, reasons, research that was done that wasn't very accurate and blown out of proportion, I should say, in terms of why someone should stay away from HRT, which is absolutely not the case. And I've seen so many patients feel so guilty, be like, I will not do HRT because they feel like they just want to go the natural route. And then, finally they get to a point where they feel so horrible. They're like, let me just give this a try. And then they're like, oh my God, why did I push back for so long? Why did I, resist this? And it really helped the quality of my life. And I've seen and heard stories like this. I can't even tell you countless of times where, a person feels like they can't choose the HRT or the birth control because it's not natural. And we need to really move away from that.
Right. Again, so perfect, so ideal to get us to really take personal responsibility and know where we can reach out to when we have questions or to run past an idea. So I think, like with Norix, that's a good place to check out and do ask these questions. True.
Absolutely.
Yeah.
Absolutely.
Okay. You also have your own website where, there's just this broad wealth of information. So we should mention that as well.
Oh, well, thank you. Yeah, I have, in the time that I have of working and being a mom, this is sort of my way of trying to help in like the public health standpoint of having, valid evidence-based information. I do have an Instagram, Dr. Navya Mysore. You can find me there. I also have a website where I have just a number of different articles that I've worked on over the years with media outlets on various topics, women health related, but also primary care related. And yeah, that's a little bit about me.
That is great. And here's another like big question, and maybe not much time really to fit in a lot of information. So we could go back to both of these sources, Nurex and Dr. Navya Mysore. But it's regarding, we're moving into the fall season. We think about vaccines, vaccinations. Of course, there are different ones that need to be done throughout the year, but here we are with a whole bunch of tumult in this whole field now. Where is your stance with our getting vaccines?
Absolutely. That's a great question, especially with fall around the corner. And the flu vaccine, usually comes up pretty early in the season. I will say, with flu and the COVID vaccine, because those are sort of the two big questions that people will come and ask me about, like, should I be getting this in the fall? I really do think the flu vaccine can help prevent you from getting the flu. It's not always a perfect match to the strain that is there for the season. So that, I've definitely had individuals who've gotten the flu vaccine and then ended up getting the flu. But the majority of people who do get the flu vaccine, it does a fairly good job of preventing you from getting the flu. Also, more importantly, if you have people around you who are immunocompromised and suffering from an illness where the flu could really do damage to them, right? Could be really severe for them and they could land in the hospital because of getting the flu. That's where I think the protection comes into play, where you are not only protecting yourself, but you are protecting your loved ones around you who may be immunocompromised. And for COVID, the guidelines have changed and shifted over time, but I usually will tell people go see your primary care doctor, run through what your issues are, what your medical concerns are, what your health conditions are, and see if you are a candidate for the booster and have that discussion because I really do think it is a little bit of shared decision making when it comes to vaccines in general. But, rule of thumb with the flu shot is you can't go wrong, and I think you will definitely give yourself protection and your loved ones around you. And for the COVID shot, talk to your healthcare provider and see if it's a good fit for you.
Perfect. That is words of wisdom. So you are just so wonderful. It's so such a gift to have. You're welcome. Well, it's a gift to have you join us. To what I hear is a voice of reason. Do your research. It's not like, well, this is what I say you should do, and you should do it. So I really appreciate that engagement, though, that you're suggesting and, recommending one-on-one, each of us is an individual. We need to find that answer for us.
Absolutely. Absolutely.
Yeah.
It has to be shared decision making, right? It's not a one-way stream.
Yes.
And more so than anything in this day and age, because we have access to so much information and are able to understand all of this on our own, healthcare providers need to understand that it is a conversation with patients, and to engage in those conversations. And frankly, if you do, you end up having a patient who follows through more on what their care plan is, and it ends up being a better outcome for everybody.
Right. Exactly. Well, you, again, are wonderful, Dr. Mysore. I so
Thank you
appreciate
so much for having me. I really appreciate it.
Oh, you are so welcome. It's been great, and I trust it's going to help each and every one of us really make good choices, make wise decisions, and be healthy.
Yes,
Right.
thank you so much.
You're so welcome.
I appreciate you having me here, and have a great weekend.
Back to the weekend again. Yes, absolutely. Thank you for being here this morning to meet these wonderful guests, doing great work and encouraging us in living a good and healthy life. Please check the station's website for the podcasts for more information about these guests, and please share the stories with your family and friends. I'm Kate Daniels. If you'd like to connect with me, simply send me an email, katedaniels@hubbardradio.com, and keep on enjoying this beautiful day.
Thank you for listening to Inspirational Women. Tune in every Sunday morning at this time to hear about those truly empowering the Northwest community, all for the greater good. Sunday Morning Magazine and Inspirational Women are a public service of Hubbard Radio Seattle.